Have you ever wondered how to measure and do a blood pressure accurately? Did you know that crossing your legs, talking, and even laughing can alter your blood pressure reading? All these few things can cause your blood pressure reading to be either false positive or a false negative. Higher reading, lower reading. I'm going to show you today how to measure and properly take a blood pressure reading. Fun fact, did you know that in the United States, more than half of the adults have high blood pressure? It's actually more of a scary fact because blood pressure, having hypertension, is also known as the silent killer, meaning that there are many people out there who don't realize that they have it, and they have it, and this can cause a heart attack or a stroke. Learning how to properly take your blood pressure can not only save your patients, but your loved ones as well. You can properly teach them how to take their blood pressure reading and how to accurately measure it, and when to notify someone of an abnormal result. This can help prevent future and potential this can prevent future health potential risks. All right. This is a blood pressure cuff. It's very important to make sure that when you have your patient, that you know their cuff length, or make sure you have the proper blood pressure cuffs. This is going to be a regular cuff. First off, I'm going to put it around the patient's arm and wrap it around properly. I have a manual blood pressure cuff. Most people have a digital one. It's the same thing. You're going to want to make sure that the cuff fits around the arm. Make sure the patient relaxes their shoulder. And then make sure it fits around their arm length. You're going to have, there's the artery arrow facing correctly down the vein area, which is like the artery area. And then you're going to watch your blood pressure. But before you do that, make sure your patient has been sitting down for at least a minimum of 5 minutes. I know this is really impossible to do in the medical field. So when you are in the medical field, just make sure that they're sitting down for a minimum of 2 minutes. That way you can get a proper reading. Make sure that they're sitting down comfortably with their back straight against the wall, feet flat on the ground. And then usually you want to make sure that there's a table there to help lift their arm up at heart level. That's really important. If you don't have that, and their palm facing up. If you don't have that, you can always hold their arm, make sure that their shoulder is relaxed, and then you can dangle it. Go ahead and relax. There you go, you can dangle it. That means that they're fully relaxed. You will have control of the patient's arm. Then you're going to want to put your stethoscope on. And you're going to want to pump it up to 200. Once you pump it up to 200, you're going to want to slowly release the pump. Listen to the first heartbeat and the last. Release the air. Remove the blood pressure cuff. And then once you're done, you're going to want to jot down the blood pressure number, which was 128/68. And then make sure you record the date and time. This is very important because if you keep track of this and in the future you find out that there's another number that's higher or lower, you can now record the time and date of what you were doing when you did that blood pressure reading and figure out what's going on. If you have to repeat your blood pressure, just understand to wait a minute in between taking the blood pressure reading, and then always go with the second number. Your provider will need both numbers, but always use the second number as it is more accurate. And voila.